And joining me in studio now is Mr. Dean Janes. He's the CEO of IMGG Incorporated. IMGG is a stock symbol. Dean's been a little while. Good to see you.
It has. Good to see you too, Don.
Well, we'll start right now from the very beginning and tell us again what the company does, and I know we can get into some more exciting news as we get along.
Oh, great. Yeah, the IMGG, we create the Dominion Volumetric Imaging Scanner. It's a mobile device, scans around the body in 360 degrees, takes those images, puts it into a 3D construct, and then updates it again every second, or every 0.2 to 0.8 of a second. Takes those images, puts it into a 3D construct, and giving you 3D real-time imaging. It's a mobile device. It plugs into regular wall power and fits through a regular room door and can be moved throughout the facility, in the surgical environment, in the ER, into interventional labs. It's less than a third the cost of a CT scanner, and it's pending FDA approval.
Well, now I know you folks are getting ready here in a week or two to go to Chicago.
Yes.
Big convention up there, and I remember last year you said you were kind of the darling of the convention. Now that you're closing in on that FDA approval, you guys are probably going to be the media star of this convention.
We're hoping so. I mean, we're really excited. This is a really good time. We're building towards that perfect storm. I feel that we're really close with FDA. The issues that we're working through right now are very minor, and we're looking to, or hoping, to have that perfect storm of having FDA approval, being at the show, and having a great showing there.
Okay, so you're thinking those two things, Jupiter could align with Mars. About the time you go to the show, you could have this FDA approval. We're that close?
We are, really. They're looking at modifying our intended use statement, or at least doing an evaluation of our intended use statement. It's our label. It's like a prescription bottle label.
Okay.
You know, meant to be used for X, Y, and Z procedures and Y. And you know, from my experience, I've done 5 FDA 510Ks. You know, this is my 5th. This is towards the end of the procedure. This is towards the end of this long, drawn-out process.
Because we've been talking with your company now pretty close to a year.
Yeah.
And we're at the kind of the beginning of the FDA process. We've kind of followed it all through 2009. You can kind of see the finish line coming now, is what you're telling me.
Oh, most definitely. I mean, I see. There are times where it seemed more vague, but now this is definitely close to the end, if not the end of this actual process.
Well, that's really exciting. And when's the show in Chicago?
It's right after Thanksgiving, the weekend after Thanksgiving, and we're in a really good place. Our booth is in between GE and Toshiba. Couldn't be better. Main center aisle. It's going to be a great show for us.
Well, when you get that FDA approval, you did promise us that we'd get a scoop. So
you do get the scoop.
Once again, IMGG Incorporated, IMGG. Good luck with that. Keep us posted.
Thanks, Don.
And